You wake before the alarm and the first thing you notice is your mouth. Your tongue feels thick and strange, adhered to the roof of your mouth like it has been glued there overnight. Your lips are cracked, your throat scratchy, your first swallow of the day uncomfortable in a way that requires actual effort. You reach for water and drink urgently, feeling the liquid hit parched tissue that seems to absorb it immediately without relief. You do not think much of this. You assume everyone wakes up this way, that morning dryness is simply what happens after hours of sleep, that the body naturally dehydrates overnight and a glass of water restores normal function. You have experienced this so consistently for so long that it has become your normal, unremarkable and unexamined, simply how mornings begin. But this morning ritual that seems like nothing may actually be something significant. The dry mouth you dismiss as ordinary could be your body's attempt to communicate about processes occurring while you sleep, processes that range from minor inconveniences to serious health concerns requiring attention. Your mouth is trying to tell you something. The question is whether you are listening. I want to explain what dry mouth upon waking actually means, what it reveals about what happens during your sleep, and why this seemingly trivial symptom deserves investigation rather than dismissal. This is not about creating anxiety over a common experience. This is about understanding your body's signaling system well enough to recognize when signals merit response. Let me begin with what saliva actually does, because understanding its function reveals why its absence matters. Saliva is not simply moisture. It is a sophisticated biological fluid performing multiple essential functions simultaneously. Dismissing it as just water in your mouth misses the complexity of what your salivary glands produce and why that production matters for your health. Saliva begins the digestive process before food ever reaches your stomach. Enzymes in saliva start breaking down starches immediately upon chewing. This pre-digestion prepares food for what happens further down the digestive tract. When saliva is inadequate, this initial processing is compromised, affecting digestion from its earliest stage. Beyond digestion, saliva provides constant protection for the tissues of your mouth. It coats surfaces with proteins and minerals that shield against damage from acids, from temperature extremes, from the mechanical friction of chewing and speaking. Without this protective coating, oral tissues become vulnerable to injury that would not occur in properly hydrated conditions. The antimicrobial properties of saliva represent another crucial function. Your mouth contains hundreds of bacterial species, most harmless or beneficial when properly balanced. Saliva contains compounds that control this bacterial population, preventing overgrowth of harmful species, maintaining the ecological balance that keeps your oral environment healthy. When saliva flow diminishes, this control weakens. Bacterial populations shift towards species that cause disease. Saliva also maintains the mineral balance of tooth surfaces, providing calcium and phosphate that constantly repair the microscopic damage teeth sustain during normal use. This remineralization process continues around the clock in a healthy mouth, preventing the cavity formation that occurs when demineralization exceeds repair capacity. Reduced saliva means reduced remineralization, accelerated decay, and dental problems that would not otherwise develop. When you wake with a dry mouth, all these functions have been compromised during your sleep. The digestion priming is absent. The tissue protection is absent. The antimicrobial control is absent. The remineralization is absent. Hours pass each night with your mouth operating without the fluid it needs for basic maintenance. The morning dryness you dismiss is actually the aftermath of an extended period of oral dysfunction. The most common reason for waking with a dry mouth is breathing through your mouth during sleep rather than through your nose. This seems like a minor distinction, but its consequences are substantial. Your nose is designed for breathing, equipped with structures that warm, filter, and humidify the air before it reaches your lungs. Your mouth lacks these features. When you breathe through your mouth overnight, you're passing dry air across moist tissue for hours, evaporating the saliva that should be protecting your oral environment. Many people have no idea that they breathe through their mouths while sleeping. They fall asleep with their mouth closed and assume it stays that way. But sleep relaxes the muscles that hold the jaw closed. The mouth falls open. Breathing shifts from nasal to oral without conscious awareness. You wake with a dry mouth and no memory of how it happened. The reasons for mouth breathing during sleep vary considerably. Nasal obstruction is among the most common. Allergies that inflame nasal passages, Structural issues like deviated septums, chronic sinus inflammation, enlarged tissues in the nasal cavity, all can create enough resistance that breathing shifts to the path of least resistance, the mouth. You may breathe perfectly well through your nose during the day when you are upright and alert, but lying down at night changes the physics of your airway in ways that produce obstruction. Environmental factors contribute as well. Dry bedroom air, particularly during winter when heating systems remove moisture, increases the evaporative loss from oral tissues. The combination of mouth breathing and dry air accelerates the dehydration that produces morning symptoms. You wake not just with a dry mouth, but with a mouth that has been drying all night in conditions that maximized moisture loss. But mouth breathing during sleep can indicate something more concerning than simple nasal obstruction. Sleep-disordered breathing, which includes conditions ranging from mild upper airway resistance to severe obstructive sleep apnea, often manifest with mouth breathing as the body attempts to maintain adequate airflow despite a compromised airway. Sleep apnea deserves particular attention because its consequences extend far beyond morning dry mouth. Though dry mouth is often among its symptoms, in this condition, the soft tissues of the throat collapse during sleep, partially or completely blocking the airway. Oxygen levels drop. The brain senses the danger and triggers a microarousal, a brief awakening sufficient to restore muscle tone and reopen the airway. Breathing resumes, often with a gasp or snort. The person falls back asleep, usually without remembering the awakening, and the cycle repeats, potentially hundreds of times per night. The person experiencing this does not feel themselves choking repeatedly. They do not remember the awakenings. They may believe they slept through the night undisturbed. What they notice is that they wake unrefreshed despite adequate hours in bed. They feel tired during the day despite apparently normal sleep, and they wake with a dry mouth, because the gasping, open-mouthed breathing that accompanies the apnea events produces the same drying effect as ordinary mouth breathing, often more severely. The health consequences of untreated sleep apnea are serious and well documented. Each apnea event drops oxygen levels and triggers stress responses. Blood pressure spikes, heart rate fluctuates, stress hormones release. Repeated hundreds of times nightly for years, these events place enormous strain on the cardiovascular system. The association between sleep apnea and hypertension, heart disease, stroke, and arrhythmias is strong and well established. What seems like simple snoring and morning dry mouth can indicate a condition silently damaging your heart and blood vessels every night. If you wake with a dry mouth and also experience any of the following, the possibility of sleep apnea deserves investigation. Loud snoring reported by bed partners, witnessed gasping or choking during sleep, waking with headaches, excessive daytime sleepiness despite adequate sleep hours, difficulty concentrating, irritability that seems disproportionate to circumstances. These accompanying symptoms suggest that the dry mouth is not isolated, but part of a pattern indicating disordered breathing during sleep. Another pathway to morning dry mouth involves metabolic processes that have nothing to do with breathing patterns. When blood sugar rises above normal levels, the kidneys respond by excreting the excess glucose in urine. This glucose draws water with it through osmotic effects, increasing urine volume and promoting fluid loss. The body becomes dehydrated from the inside out as fluid is pulled from tissues to supply the increased urination. Dry mouth is among the classic early symptoms of elevated blood sugar, whether from undiagnosed diabetes, poorly controlled known diabetes, or the pre-diabetic state where blood sugar is above optimal, but not yet in the diabetic range. The dryness reflects systemic dehydration that affects the entire body, manifesting particularly in the mouth because oral tissues are sensitive indicators of fluid status. The accompanying symptoms of blood sugar elevation often develop so gradually that they become the new normal without being recognized as symptoms. Increased thirst, which would make sense given the dehydration, becomes constant without triggering alarm. Frequent urination becomes routine without prompting investigation. Fatigue, blurred vision, slow wound healing, subtle tingling in the extremities, all can accompany elevated blood sugar without being connected to their cause. Morning dry mouth in this context is particularly significant because blood sugar often runs highest overnight and in the early morning hours. This is when the dehydrating effects are most pronounced, which is why the symptom appears most prominently upon waking. The person who dismisses their dry mouth as ordinary overnight dehydration may be missing an early signal of metabolic dysfunction that, if addressed, could prevent progression to full diabetes and its complications. If your morning dry mouth is accompanied by increased thirst, increased urination, unexplained fatigue, or any of the other subtle signs of blood sugar elevation, screening is warranted. Simple blood tests can assess your glucose status and identify problems at stages where intervention is most effective. The dry mouth that prompts this investigation may be the symptom that prevents a serious disease from progressing undetected. Medications represent another common cause of morning dry mouth that often goes unrecognized. The list of drugs that can reduce saliva production is extensive, including many commonly prescribed for conditions prevalent in middle and later life. Antidepressants, antihistamines, blood pressure medications, drugs for overactive bladder, muscle relaxants, sedatives, pain medications, medications for Parkinson's disease, and many others can affect salivary gland function as an unintended side effect. The mechanism varies by medication class. Some drugs block neurotransmitter receptors involved in stimulating saliva production. Others affect fluid balance throughout the body. Some simply dry tissues as a direct effect. Whatever the mechanism, the result is reduced saliva that may not be apparent during the day when you are drinking and eating regularly, but becomes pronounced overnight when hours pass without fluid intake. People often do not connect their dry mouth to medications they take because the symptom may not appear immediately when a medication is started. It may develop gradually as the drug accumulates in the system, or as the body's compensatory mechanisms are exhausted. The person has been taking the medication for months when they notice the dryness, making the connection less obvious. The additive effects of multiple medications can be particularly significant. Each individual drug might have only modest saliva-reducing effects, but when combined, the impact becomes substantial. The person taking an antidepressant, an antihistamine, and a blood pressure medication may experience dryness from the combination that none of these drugs would produce alone. Polypharmacy, the use of multiple medications simultaneously, is common in older adults and contributes significantly to the prevalence of dry mouth in this population. If you take medications and experience morning dry mouth, reviewing this with your physician or pharmacist may identify drugs contributing to the problem. Sometimes alternatives exist with less drying effect. Sometimes dosing adjustments help. Sometimes simple awareness allows you to implement compensatory strategies that mitigate the dryness without changing your medical treatment. The solution requires identifying whether medications are contributing, which requires the deliberate investigation that does not happen when you assume dry mouth is simply normal. The consequences of chronic dry mouth extend beyond morning discomfort into lasting damage that compounds over time. When saliva is chronically insufficient, the oral environment shifts in ways that promote disease. The bacterial populations of your mouth change when saliva control weakens. Species that cause cavities and gum disease thrive in the altered conditions. The acids they produce attack tooth enamel that is no longer being remineralized adequately. Cavities develop faster and more extensively than they would in a normally hydrated mouth. Dental work that has lasted for years begins failing as new decay undermines fillings and crowns. Gum disease accelerates in dry conditions. The inflammation that characterizes gingivitis and periodontitis is held in check partly by salivary components that modulate immune responses and control bacterial growth. Without this modulation, inflammation intensifies, gums recede, bone supporting the teeth is lost, teeth become loose and eventually may be lost entirely, not from the dry mouth directly, but from the cascade of problems that chronic dryness initiates. The connection between oral health and systemic health has become increasingly clear as research has documented associations between gum disease and conditions including heart disease, diabetes, respiratory infections, and cognitive decline. The inflammation and bacterial populations of an unhealthy mouth do not stay confined to the mouth. They affect the entire body through mechanisms still being fully understood. The dry mouth you dismiss as trivial may be the first step in a progression that affects your cardiovascular health and more. General dehydration from causes unrelated to disease can also manifest as morning dry mouth. Many people are chronically underhydrated without recognizing it. They drink when obviously thirsty but do not maintain adequate fluid intake throughout the day. By bedtime, they are already in a fluid deficit that overnight hours without drinking exacerbate. Caffeinated beverages, which many people consume heavily, contribute to this pattern. Caffeine is a mild diuretic, increasing urine output and fluid loss. A person who drinks coffee throughout the day and little water may be losing more fluid than they are taking in, despite seemingly constant drinking. The same applies to alcohol, which has more pronounced diuretic effects and often is consumed in the evening hours when its dehydrating effects compound overnight. Exercise without adequate rehydration leaves fluid deficits that may persist into sleep. High-sodium diets can affect fluid balance in ways that produce tissue dryness despite adequate total body water. Hot sleeping environments increase sweating and fluid loss. Each of these factors can contribute to the morning dryness that seems like it should be simple to explain, but actually reflects multiple influences. The subjective sense of adequate hydration is surprisingly unreliable. People who believe they drink enough often do not when intake is objectively measured. The elderly often experience diminished thirst sensation that does not accurately reflect their fluid needs. Children and adults alike can operate in chronic low-grade dehydration without recognizing it as such. The morning dry mouth may be the most obvious symptom of a hydration status that remains suboptimal throughout the day. A less common but important cause of dry mouth involves autoimmune processes that damage the glands producing saliva. In conditions like Sjögren's syndrome, the immune system attacks moisture-producing glands throughout the body. The salivary glands and tear glands are primary targets, producing a combination of dry mouth and dry eyes that is characteristic of the condition. Sjögren's syndrome often goes undiagnosed for years because its symptoms seem non-specific and develop gradually. Dry mouth is attributed to aging or medication. Dry eyes are addressed with over-the-counter drops without investigating the underlying cause. Fatigue, joint pain, and other systemic symptoms that may accompany the condition are attributed to other causes or simply accepted as normal discomforts. The condition can exist on its own or alongside other autoimmune diseases including rheumatoid arthritis and lupus. It affects women far more frequently than men and typically develops in middle age, though it can occur at any time. The dryness it produces differs from other causes in that hydration does not resolve it. You can drink water constantly and still experience the dryness because the glands producing saliva are damaged and unable to respond to the body's signals for increased output. If your dry mouth is accompanied by persistently dry, gritty-feeling eyes, if it does not improve with increased fluid intake, if you experience fatigue and joint pain alongside the dryness, evaluation for autoimmune causes is warranted. The diagnosis requires specific testing and specialist evaluation, but can lead to treatment that manages symptoms and prevents progression. The nervous system's role in saliva production provides another pathway through which dry mouth can develop. Saliva production is controlled by the autonomic nervous system, the same system that regulates heart rate, digestion, and stress responses. When you are relaxed, in what is called the parasympathetic state, saliva flows freely. When you are stressed, in the sympathetic fight-or-flight state, saliva production decreases as the body redirects resources toward functions needed for immediate survival. Chronic stress keeps the body in a state of persistent sympathetic activation. The relaxation response that should dominate during rest never fully engages. Even during sleep, stress arousal may persist at levels that suppress saliva production. You wake with a dry mouth, not because anything is wrong with your salivary glands, but because your nervous system is not allowing them to function normally. This stress-related dryness often accompanies other signs of chronic stress activation: tension in the jaw and neck, teeth grinding during sleep, disrupted sleep quality despite adequate hours, difficulty relaxing even when circumstances should allow it. The dry mouth is one symptom in a constellation reflecting a nervous system stuck in a mode inappropriate for rest and recovery. Addressing this cause requires addressing the underlying stress activation, which may involve lifestyle changes, stress management practices, therapy for anxiety or trauma, or other interventions targeting the nervous system dysregulation. Simple hydration will not solve the problem, because the problem is not fluid deficit but glandular suppression. Acid reflux during sleep represents another cause of morning oral symptoms that may include dryness. When stomach acid travels up the esophagus and reaches the throat and mouth, it irritates tissues and can disrupt the normal function of salivary glands. The irritation may trigger excessive saliva production in some people, but suppress it in others, depending on individual responses. The morning symptoms of nocturnal reflux can include a sour taste, hoarseness, throat irritation, and dryness that reflects the tissue damage caused by repeated acid exposure. The person may not experience classic heartburn, but still suffer from acid reaching the upper digestive tract during sleep when the horizontal position facilitates reflux. Reflux is particularly common after late or heavy meals, after alcohol consumption, in people who are overweight, and in those with hiatal hernias or weaker esophageal sphincter function. The morning symptoms it produces can be confusing because they do not necessarily match the classic reflux presentation of burning chest discomfort after meals. Silent reflux, as this variant is sometimes called, produces upper airway and oral symptoms without the typical heartburn. If your morning dry mouth is accompanied by throat irritation, voice changes, or a sour taste, reflux may be contributing. Addressing it through meal timing, sleeping position, weight management, or medical treatment can resolve symptoms that seemed unrelated to digestive function. Age-related changes in salivary gland function do occur and deserve mention, though they rarely fully explain severe dry mouth symptoms. As people age, salivary glands do tend to produce somewhat less saliva, and the composition of saliva may change in ways that reduce its protective functions. These changes are gradual and modest in healthy aging, typically insufficient on their own to produce the troublesome dryness that prompts investigation. When an older person experiences significant dry mouth, age-related changes may contribute but are rarely the sole explanation. More commonly, other factors, medications, medical conditions, breathing patterns, dehydration, are layered onto whatever age-related decline has occurred. Attributing dry mouth entirely to aging often prevents the investigation that would identify treatable causes. Throughout everything I have described, a consistent theme emerges. Your body communicates through symptoms. Morning dry mouth is one form of communication, a signal that something about what happens during your sleep deserves attention. The signal may indicate something minor like needing a humidifier in your bedroom. It may indicate something significant like sleep apnea, silently damaging your cardiovascular system. It may indicate something metabolic like blood sugar elevation that, caught early, can be addressed before complications develop. The tendency to normalize symptoms, to assume that because something is common, it must be insignificant, causes people to miss these communications. The body is not complaining about nothing. The body is reporting on its condition. The report deserves consideration rather than dismissal. What should you do if you regularly wake with a dry mouth? The answer depends on what investigation reveals about the cause, but several steps are appropriate for anyone experiencing this symptom. Consider whether your breathing patterns during sleep might be contributing. If you or a bed partner notice mouth breathing, snoring, gasping, or other signs of airway issues during sleep, evaluation for sleep-disordered breathing is warranted. This typically involves a sleep study that can be conducted in a sleep laboratory or increasingly at home with portable monitoring equipment. The investment of time and effort is justified by the serious health consequences of untreated sleep apnea. Assess your hydration patterns honestly. Track your fluid intake for several days to see whether it actually reaches adequate levels. Reduce or eliminate caffeine and alcohol, at least experimentally, to see whether your symptoms improve. Address environmental factors like bedroom humidity that might be contributing to nighttime drying. Review your medications with a pharmacist or physician. Bring a complete list of everything you take, including over-the-counter products and supplements. Ask specifically about effects on saliva and whether alternatives or adjustments might reduce dryness while still addressing the conditions being treated. Consider whether metabolic screening is appropriate given your symptoms and risk factors. Blood sugar testing is simple and can identify problems at early stages when intervention is most effective. If you have other symptoms that might suggest blood sugar issues, testing becomes particularly important. Maintain excellent oral hygiene to mitigate the effects of whatever dryness you experience. Brush and floss diligently. Consider fluoride rinses or gels that provide additional protection for teeth vulnerable to decay. See your dentist regularly and mention the dry mouth so they can monitor for the accelerated dental problems that chronic dryness can cause. Address stress if chronic activation seems to be contributing. This is not simple advice. Stress management involves multiple approaches, and what works varies by individual. But recognizing that your nervous system's state affects saliva production can motivate attention to stress that might otherwise be dismissed as unavoidable. If basic interventions do not resolve your symptoms, pursue further medical evaluation. Autoimmune causes, though less common, require specific testing to identify. Other medical conditions can affect salivary function in ways requiring treatment beyond simple lifestyle modification. The investigation that starts with a common morning symptom may lead to diagnoses that significantly affect your long-term health. The message I want to leave you with is one of appropriate attention rather than alarm. Dry mouth upon waking is common. It is usually not an emergency, but it is also not nothing. It is your body communicating about conditions that deserve understanding. The communication may be minor, reporting on dry bedroom air or insufficient water intake. Or it may be significant, signaling sleep apnea, metabolic dysfunction, or autoimmune disease that benefits from early detection and treatment. You do not need to panic about a dry mouth. You do need to pay attention. The difference between those responses is what separates people who catch problems early from those who discover them only after damage has accumulated. Your body is talking. Tomorrow morning, when you wake with that dry mouth, consider what it might be trying to tell you. The conversation could matter more than you ever imagined. The simple act of taking your morning symptoms seriously, of investigating rather than dismissing, of treating your body's signals as worthy of response. This is how you participate in your own health, rather than passively experiencing whatever happens. The dry mouth is the invitation to that participation. What you do with the invitation is up to you, but now you understand enough to make that choice with awareness rather than assumption. Your mouth, your sleep, your metabolism, your medications, your stress, your hydration, all are connected in the web of factors that produce this seemingly simple symptom. Untangling which factors apply to your situation requires attention and perhaps professional help. But the untangling is worthwhile because what you learn informs how you care for yourself going forward. Tomorrow morning, notice your mouth. Notice what it is telling you, and consider whether the message deserves a response beyond reaching for a glass of water and moving on with your day. That small shift in attention could be the beginning of understanding something important about your health, something you've been dismissing for years, something that finally gets the attention it has been asking for all along.